Hello and welcome back to my YouTube channel. My name is Maureen Sullivan. I'm a registered nurse as well as a certified diabetic educator and an emergency room nurse. Excited to be back with you again. It is February and February is hallmarked, if you will, for heart health and healthy heart awareness initiatives. And according to the American Heart Association, February is full of activities that guide us through healthier heart-related practices and our health and our well-being. And so I'd like to take a few videos this month and just focus on heart health and ways that we can improve our overall health and well-being specific to heart-related activities. So today's video, short and sweet, but so important, how to identify symptoms of a heart attack. I'll preface this by saying if you're having any of these symptoms, and I'm about to read off my little cheat card here, it's really important to call 911 for an evaluation. I'm not saying that you won't necessarily end up in an emergency room, but you need emergency personnel to come to you wherever you're at, whether it be a home office, your home setting, your job site, anything. Let them evaluate you and make sure the worst case scenario that you're having a heart attack is or isn't the issue here. So, in no particular order, signs and symptoms of a possible heart attack. Now, I know as I read these, you'll be able to say, oh, I had that and it wasn't a heart attack, it was this and that. But if for no other reason, understand these symptoms, as I'm going to discuss them, are very serious and highly suspected for some heart irregularity. So if you're having chest discomfort and chest pain or discomfort in your upper body, in your arms, it could be in your upper back, your neck, and even your jaw, and this pain doesn't go away in a couple of minutes, despite what you do or don't do, that is a symptom that there may be something related to your heart function. Some area is not getting enough blood, your heart is under stress, something to be checked out. Also, if you suddenly get very short of breath for no known reason, that's another indication you're not getting adequate blood supply. If you break out in a cold sweat and suddenly become nauseous, even to the point of vomiting, those are also reasons that if there's no other extenuating factors that may be causing it, you need to be evaluated under a 911 or emergency setting. Also, if you have lightheadedness all of a sudden, you stand up and the room is dizzy or you feel like you're going to pass out, again, 911 or your comparable emergency medical services first responder. The interesting thing, if you look up on the American Heart Association's website, as well as other medically established organizations, there's a little caveat there that says women may experience different symptoms, and I'd just like to discuss that for a minute. Historically, and I say this as an emergency room nurse, historically, women are a little more resistant to being evaluated for chest pain, chest discomfort. Our plates are usually very, very full with responsibilities, and a lot of times we kind of push the self-care to the back here, or we kind of negate, and I've done it myself. Oh, well, I'm hurting. It must have been when I lifted something, or I did too much, or I strained this, or anything. I can talk myself out of possible seriousness of these symptoms, and that's what this little caveat is here. So in addition to these usual symptoms for heart attack, chest pain, or the medical term angina, women also may experience an unusual onset of tiredness and weakness. And I mean unusual, like I just woke up and I can't get up, or I can't get up out of the chair without assistance, just this profound sudden onset of weakness. And you and I both know that we could probably come up with many ways to rationalize why I'm all of a sudden tired and weak. Also, if you have this sudden, attack, if you will, of anxiety out of no reason, it could be, altered blood flow or that sense of impending doom. Something is not right. But again, nausea to the point of vomiting, and then the pain in the shoulders, in the upper back, or in the arms. And again, I say it kind of, with a smile on my face. I could take each of these symptoms and give you some reasons why I think it's everything and anything but a heart attack. But as a nurse, I'm here to tell you and share the information from that recognized source, the American Heart Association, that these are all signs and symptoms that should be ruled out, checked out for a possible heart attack. So for more information, head on over to the American Heart Association. Their website is www.heart.org. Very simple, heart.org. For now, thanks for sharing your time with me. Please leave a comment, a like, a share, tag somebody else on this video. It's really basic information, but it is really important information. And stay tuned throughout the month for more heart-related heart health videos. But for now, again, my name is Maureen Sullivan. Appreciate your time. Have a great evening and a healthy heart month. Thank you.